using public transportation, visiting a place of worship, or otherwise traveling from the home is associated with a significantly higher likelihood of testing positive with the coronavirus SARS-CoV-2, while practicing strict social distancing is associated with a markedly lower likelihood, suggest. For their analysis, the researchers surveyed a random sample of more than 1,000 people in the state of Maryland in late June, asking about their social distancing practices, use of public transportation, SARS-CoV-2 infection history, and other COVID-19 relevant behaviors. They found, for example, that those reporting frequent public transport use were more than 4 times as likely to report a history of testing positive for SARS-CoV-2 infection, while those who reported practicing strict outdoor social distancing were just a tenth as likely to report ever being SA. The study is believed to be among the first large-scale evaluations of COVID-19 relevant behaviors that is based on individual-level survey data, as opposed to aggregated data from sources such as cell phone apps. The results were published online on September 2 in Clinical Infectious Diseases. Our findings support the idea that if you're going out, you should practice social distancing to the extent possible because it does seem strongly associated with a lower chance of getting infected, says study senior author Sunil Solomon, MBBS, PhD, mile per hour, an associate professor in the Bloomberg SC. Studies like this are also relatively easy to do, so we think they have the potential to be useful tools for identification of places or population subgroups with higher vulnerability. The novel coronavirus SARS-CoV-2 has infected nearly 27 million people around the world, of whom some 900,000. In the absence of a vaccine, public health authorities have emphasized practices such as staying at home, and wearing masks and maintaining social distancing while in public. Yet there hasn't been a good way to monitor whether, and among which groups, such practices are being followed. Solomon and colleagues, including first author Stephen Klipman, a PhD candidate in the Bloomberg School's Department of International Health, quickly accessed willing survey participants via a company that maintains a large nationwide pool of potential participants as a commercial service for market. Please support our channel to grow by pressing subscribe button as well as the bell icon for daily science updates. Thank you.